treatment for hepatitis C has changed dramatically in the last decade. Previously, it was a very difficult treatment, a long treatment involving injections with interferon for between 6 and 12 months, combined with a drug called ribavirin. Over the last decade, we've developed new drugs that directly target the life cycle of the virus. And it means that we can treat hepatitis C in 8 to 12 weeks with a single tablet with minimal side effects, and it's effective in over 95% of cases.
Viral hepatitis, primarily hepatitis B and hepatitis C, are cancer-causing viruses that are treatable and, in the case of hep C, curable. So what we're trying to do is find everybody that we can who has hepatitis C, get them diagnosed, get them into treatment, and get them out the other side so that they can hopefully live long and happy lives without liver disease, without liver cancer, and without the risk of end-stage liver disease and death.
Currently, pregnant women are tested for hepatitis B, HIV, and a variety of other infections at 12 weeks. They are not tested for hepatitis C because the National Screening Committee only tests for infections that we can prevent transmission from mother to child. So, for instance, if there's a vaccine like hepatitis B, or there's treatment like HIV. Currently, there are no vaccines against hepatitis C or any treatment that we know is safe in pregnancy. Hence, the screening does not take place. However, I think the situation is very different now to when they first made their recommendations, because we have such effective treatment for hepatitis C that we can, if we identify the mother, the infected mother in pregnancy, we can treat her after the pregnancy, and should her baby be infected, we can treat the child as well from the age of 3. So it seems to me entirely sensible to screen during pregnancy. The additional cost of adding the viral test is about £5 per patient.
The antenatal clinic is an ideal opportunity for testing for hepatitis C for a number of reasons. Firstly, it's what we call opportunistic testing. Now, we test every woman coming into the antenatal clinic for hepatitis B, HIV and syphilis. This involves a blood test.
If we can do an opt-out test with them, just on the basis of we test everyone, firstly, it takes away the stigma of people having to make judgments about what that individual might have done and whether or not they need a test. Well, we just test everyone, so that's much easier, it's much clearer.
We can simply add on hepatitis C in the laboratory. So we're already doing that blood test for those other reasons. It costs a fraction of the cost to add that hepatitis C test on as it would compared to doing a hepatitis C standalone. So the midwives are already taking the blood, the laboratory is already processing the blood. It's no additional blood tests for the patient.
So we add the hepatitis C screening onto the booking bloods already, so we don't need to take any additional bloods from the women. And we just explain to the women that as NHS Imperial is part of the North West London pilot scheme, checking for hepatitis C, we explain that in the unlikely scenario that we do detect a positive screening result, these women will be followed up by a hepatologist and have discussions with the obstetricians and be followed up and treated as well postnatally.
Hepatitis C is a vertically transmitted virus. In other words, it can be passed from the mother to the baby. Around 1 in 20 to 1 in 30 women infected with hepatitis C will transmit that virus to their child. Now, if we don't know that the mother has hepatitis C, we're never going to know that the child has hepatitis C. So identifying the virus in the mother means that we can test not only the child in this pregnancy, but the children from previous pregnancies where, again, hepatitis C may not have been detected in pregnancy.
Any doctor in England can refer a child between the ages of 3 and 18 to us. They can join us to discuss their patient and any particular problems that patient may have. We agree among the experts on the group which treatment is relevant. It's prescribed and delivered to the child at home. So they are treated at home pretty well with visits to their local hospital without any need to visit a specialty centre. It's very popular with families, it's very popular with referring doctors, and it's hugely satisfactory to do for me and my team because we have 100% cure.
Majority of women, they are quite happy to have the test. So in the last, we've been working for more than 2 years with the hepatitis C pilot, and we did not have many declines. So if women intend to have a screening for infection diseases, they're quite happy to have a test for hepatitis C in addition as they're having a test for hepatitis B already.
It's been hugely important, I think, to the women that we have helped. They have been very grateful that we have identified the hepatitis C virus. We've been able to offer them treatment, and in the long term we've been able to protect their health, and we've also been able to assess their babies properly afterwards, after birth, and see if we do need to offer babies treatment as well. So it's mean we've been able to kind of cut the loop of transmission, so to speak.
These samples are going through in their hundreds down this track system on a daily basis. So doing an extra antibody test is not really going to affect capacity at all, in all honesty.
I wouldn't say it's added hugely to our workload. We just add the bloods onto the booking bloods already. And the prevalence that we've had, it's been about 1 in 250 women will get screen positive results. So that is also including equivocal results. It's also including antibodies that have come up from a previous infection and also active infection. So to be honest, it's about additional counselling of probably about 2 to 3 women a month.
We estimate that there are about 62,000 people left with hepatitis C in England. That's an estimate provided by the UK Health Security Agency. We've already treated about 85,000 people, and we've seen the benefits of that already. So we've seen a 38% reduction in people dying from Hep C related causes, and we've seen a 52% reduction in the number of liver transplants that have had to be done because of people's Hep C. So we know that it's working. We know that it's saving lives, and those 62,000 people who are out there now don't know that they've got this virus that in the end could kill them. So we're trying to use as many services as we can, from emergency department testing, primary care testing, and from antenatal, to try and find those people who aren't necessarily currently putting themselves at risk, but actually need a test, and if they're positive, need treating.